Good afternoon, everyone. We're here as consultants pitching for Medcare. My name is Aditya Sharma,
My name is Benjamin Hoffman.
And I'm Evan Bowie.
and we have a proposal for the hospital. So we're going to start by addressing the current situation we're in. We're going to look at Medcare versus Titan Health. We're going to then go to the best path forward that we want to pursue. We're going to look at what the implementation for that would be and what the future roadmap would be for that as well. Some potential risks and how we would mitigate them. And finally, we're going to recap and conclude.
So just to kind of go over the current climate of Medcare, which I'm sure you guys are all familiar with, revenue's down just over 2% over the last 3 years. Operating margin is down 10 times more than that. We've lost physicians to Titan Health because frankly, we can't compete with the pay and we can't compete with the technology. And we're losing a lot of outpatient procedures as a result of that. That being said, as we're going to get into in the next slide, we still do have strength. We're still a community fixture, we still have high customer satisfaction, and we still have good money to work with when it comes to addressing these issues.
Yeah, so as Ben touched on previously, we do have a really strong standing reputation within the community, and we have a very strong location, centralized and really close to many patients that need our help. And overall, patients are just really happy with the services we provide and come back pretty often. But whereas Titan Health, they do offer higher pay, and they do have great facilities also, and they do have the brand recognition that we need to address.
And so when it comes to addressing this, we got to tackle all of these issues head on. It's about differentiating our brand from Titan Health. It's about improving our reputation in the community so that we're even more trusted than they are. It's about bringing back or bringing in more top specialists that we are losing, which is why we're sinking in orthopedic surgery and things like that. And so the way that we're going to do that is by investing, give or take, $12 million from our reserves, which we have, into centers of excellence for, in this case, orthopedics and cardiology, but who knows what that might develop into.
So let's take a look at the implementation strategy for this and some current strengths that we see. So just to start, cardiology and orthopedics have a 45% market share and a 35% market share respectively, making up 80% of the total market for surgeons. Now, if we specialize in this, we have a really high opportunity in generating more revenue from these two streams alone. Moreover, as aforementioned, we have already developed a high reputation over the past few decades, and we can use that to our advantage to pursue some of the higher sales in these specific revenue streams. Now, looking at the market, we also see that by 2030, it is projected that the population of 65 plus people is going to grow from 19% to 26%. And all this means is that those specific consumers are going to have the highest requirement and highest demand for cardiology and orthopedic surgeries, which means that we're going to differentiate ourselves from Titan Health's broad model by offering these specific things. And this will also mean that this specialty will attract more physicians as well.
And of course, don't just take our word for it. In about 2010, the Cleveland Clinic realized they had a similar problem to what we're dealing with right now. They needed more doctors and they needed more patients. And so what did they do? They opened their own centers for excellence. In this case, it was cardiacs, orthopedics, bariatrics, and cancer. But what happened was from that, they gained employee partners, which are people essentially funneling people towards the centers for excellence, because after all, it's esteemed, there's a good reputation there, and people are going to want to work there. There was 10% revenue growth in the most recent year just as a result of the Center for Excellence, and given the leaking in revenue that we've been dealing with, this is something that's very, very, very beneficial to us. Overall, their brand reputation improved, their margins and profits improved, they had a better and easier time maintaining and getting in the first place doctors to work for them, and it was a huge success. If that worked for them, why can't it work for us?
So as we try to implement these strategies into our own hospital, we would like to start off with the initial $12 million investment within the state-of-the-art facilities that would allow us to specialize. But then as we specialize and grow into becoming a more mature place of care, we'll try to introduce new recruitments for specialized physicians while also expanding and specializing our training programs for our professionals to help our new interns and residents become the best physicians they can be. And then finally, as we expand and become like a mature hospital, we would like to try to get referrals similar to how Cleveland did to get the specialized cases that we can provide care for rather than generalized. And then so some potential risks that we might see as we try to implement these strategies will be the market demand, which can be a concern. But as we saw previously with Cleveland, they saw increased demand and they were able to thrive despite specializing in niche and different cases. Furthermore, execution delays, we can see some concerns with that, but we should be able to mitigate these by slowly phasing out generalized studies and care and trying to implement slowly new technologies. And then as our financial risk goes, we do have a low amount of debt compared to other hospitals, and we can try to leverage the $8 million we have left, or $6 million we have left in funds to try to help ease that transition.
So let's go through a quick recap of everything. So the bottom line is that we're currently losing physicians to our competitors, and we need to resolve that ASAP because we're losing market share and we're losing revenue as we speak. So the best way to do that, as we mentioned, was to take this new course and focus in on orthopedics and cardiology, which by focusing on that high, on those two revenue streams and that big market, we would be able to generate a lot more revenue, hopefully by 2030 when the demand for those specific streams is going to go up, and that'll help us put ourselves in a more stable position, generate more revenue, and get back more physicians in the near future. Thank you.